Now, to go ahead and talk about the duties of a certified nursing aide, a CNA. A lot of times in my coaching and in this channel, I'm going to be using the word CNA. So you know that certified nursing assistant or certified nursing aide. I just wanted to get that out of the way. So there are many duties that a certified nursing aide will do. Now, it depends on where you work. Depends on what care setting you are practicing. Some things are allowed if you've had the training for it, and in other places is not. But the big thing you as a CNA need to know and understand and work with is your scope of practice. You've got to know what is allowed for you to do in your scope of practice. So certain things you're going to be feeding the resident. Okay, that's part of personal care. That's part of, activities of daily living. Those are things you're going to be doing. You are going to be helping people feed. You're going to be helping them ambulate, meaning moving from point A to point B. Either you're steadying them as they walk or you're helping to push the wheelchair. You're also going to toilet them. So toileting takes different ways. Is either they have an adult brief on and you're going to be changing them with dignity, with respect, and with privacy. Or you're going to assist them to the bathroom and also with dignity, respect, and privacy, help them with their toileting needs. You're going to do some type of cleaning. You're going to make sure the part where they live or they're residing is clean, either is in the nursing home or is in a home health setting or is in an assisted living. Again, it doesn't matter what the care setting is. There are basic duties that you as a CNA, you are going to perform. It's expected of you. It is well within your scope of practice. You're also going to sometimes shop for them. You provide companionship. You're going to help them reach for things they're not able to reach for. You're going to help them control the remote control for the programs they need, not yours. Remember, you're there with their permission. You're there to take care of them. So you're not sitting there watching your shows. It's about them. So I needed to put that in just in case you're misinformed. I am not going to mislead you or misinform you. So even if you're going to help them with the clicker or the remote control, is with their permission. And of course, you're turning the channel or the radio dial to where they want. Okay. You're also going to be helping them dress. You're going to make the beds. Yes, you will be making beds. And that's why also in your skills, you are tested on your ability to do so. With occupied bed, that means with a patient in bed, and unoccupied bed when there's no one in there. You are going to provide some type of support care in emotional. Now, let me explain this. You're not a therapist. You're not a psychiatrist, but your job, it's just human. As a certified nursing assistant, part of your job is also to listen. You can give back rubs. That is calming, and it also gives you a chance to be able to observe. Remember, one of your duties is observing and reporting to the nurse. Another thing you're going to be doing is mouth care. You're going to help them brush their teeth, either with a toothbrush or toothets, whatever their care plan indicates. So these are the things that you're going to be doing, basically helping or assisting them to do things that ordinarily they will do by themselves, but for whatever reason, because of their health condition or mental condition, they're not able to do so. So your job, you're their arms and their legs, their eyes and their ears, more or less. Okay, so take your job very seriously, because again, it's not easy for them to have to depend on you to do these things. I always say this in my class: put yourself in their shoes. I don't know about you, but it's not really easy for me to rely on people. Some people it's second nature. But if you're a very independent person, now, even if it's okay with certain things, shopping, changing the remote, but when it comes to very personal things like the private area, which in the healthcare field we call perineal area, those are things people get very self-conscious about. So if they're relying on you, then know that this is not an easy thing. So be sensitive and treat them with dignity, respect, and privacy. I keep saying that because those three things are very, very important.